first point to know is upholding a 15-week ban would require overruling Roe and Casey because those decisions stand for every individual's right to make this decision up until viability. So, it's hard to read tea leaves and if the court upholds this ban, sort of how it might do that, but it certainly couldn't do that without essentially overruling 50 years of precedent. So if the court overrules Roe, half the states in the country are poised to ban abortion entirely. A dozen states have what are called trigger bans that are designed to ban abortion immediately if the court overrules Roe. A number of other states have other prohibitions on the books that, ban abortion at virtually any point in pregnancy. Those bans are currently blocked as a result of court orders, and those cases would have to be likely reopened and litigated under the new decision that the court would issue this spring. There are certainly states that have repealed, old prohibitions on abortion from before Roe and have enacted proactive policies to protect access to abortion. So we would really see a deepening of the, really the two countries in which abortion is available in certain parts of the country and essentially inaccessible in others.
That would prevent us as clinicians from providing comprehensive evidence-based healthcare. We would need to work really closely with organizations, both in the states with restricted access to help support patients, to get them the care that they need, to help them with transportation and logistical support, to get to other states where care would still be available. And then those of us working in those states would again have to work with groups on the ground to help coordinate all those logistics. So it's going to be really very complicated just to provide basic healthcare services. Another really important thing to be thinking about is the training issues for learners, for medical students and residents. Abortion care is a critical element of comprehensive healthcare, and it's a required component of OBGYN training. But now these residents in particular won't be able to access that training in some of the states if this care is banned in the state. And so we'll have to make arrangements for those learners to travel to other states to be able to access care. So it's really going to be complicated. I think it's really important to recognize that patients who are seeking abortion care already face a lot of obstacles. I mean, even here in California, where I practice, patients already face obstacles accessing abortion care, like all healthcare. It can be difficult getting an appointment, arranging time off work, arranging childcare, getting transportation to the clinic. In places where Medicaid doesn't cover abortion care, uninsured people who are living on low incomes, need to put together the funding to pay for abortion care, which can take time. And then on top of that, many states impose regulations like mandatory waiting periods or 2-visit requirements, or your facility requirements that then kind of limit the number of clinics and where they're located across a given state. And all of these policies can lead to even more delays for patients. There's research showing, for example, in Texas, that there was a significant increase in second trimester abortion after Texas House Bill 2 or HB 2 went into effect there, which led to the closure of about half of the clinics in the state. Again, because the closure led to more delays and it forced patients later into pregnancy. So it's really important to recognize that these obstacles, including state level restrictions, all contribute to patients needing care later in pregnancy. So there are a whole range of negative socioeconomic and health effects on people who are forced to carry the pregnancy to term. I think we all know that the US has a very high rate of maternal mortality, and that disproportionately affects Black and Indigenous people. I'm very concerned that further restricting access to safe abortion care is really going to exacerbate maternal mortality. We know that abortion as currently provided in the United States is very safe, and it's much safer than continuing a pregnancy to term. We have data showing that childbirth is associated with about a 14-fold increased risk of death compared to abortion in the United States. And then there are additional deaths that happen for people who are continuing the pregnancy to term, but before childbirth occurs. Dr. Amanda Stevenson at the University of Colorado at Boulder has estimated that if abortion were banned nationwide and all pregnant people were forced to continue their pregnancies, that there would be about a 21% increase in the number of pregnancy-related deaths overall, and about a 33% increase among non-Hispanic Black women. There may be additional increases in pregnancy-related mortality related to unsafe abortion, but even excluding those, it's quite clear that restricting access to abortion will have a negative effect on maternal mortality.
Of course, the court could just affirm the lower courts here and say that this ban is unconstitutional. I think, that would be a huge win, but it's also really just preserving the status quo, right? Abortion access across this country is not where it should be. People, in particular, communities of color and poor people don't have the access to abortion that they should. So Roe has remained a floor and not a ceiling for the rights that everyone is entitled to. So regardless of the outcome here, there will certainly be a lot more work to do.